And now from the COVID situation at schools to how the virus is impacting the places you turn to for help when you or a loved one get sick.
That's right. As we've reported, the region's hospitals are at capacity right now.
And according to the Ohio Hospital Association, there are 958 COVID positive patients in our region's hospitals. Anchor Kristen Hartman went behind the front lines to get a better understanding of what that all means. And what'd you find, Kristen?
Well, guys, you might call it a snapshot in a bigger regional picture. St. Elizabeth Healthcare Edgewood took us onto their COVID floor via Zoom on a cell phone. That means we're able to show you things we haven't been able to see during the entire pandemic. And we're hearing from a frontliner who's been part of the response every step of the way.
That beeping right there is a patient being paged to us. That's the patient who will come and take the next room.
There it is. Proof. Very sick COVID patients just keep coming. Catching that moment in our short 43-minute tour of one unit at St. Elizabeth Edgewood says a lot about a relentless cycle.
There's a list of patients to come up here, longer than the list of patients leaving. This is 3C, the pulmonary unit at Edgewood.
The voice you hear belongs to Melissa Schumacher. She's our Zoom guide and the nurse manager of the pulmonary unit.
We typically have 32 rooms full, even without COVID. What's scary is the people who would have been here without COVID. Where are those patients?
She has also had a front row seat to the pandemic, one she would not wish on anyone.
Personally for you, is there one story that stands out that's going to live with you for the rest of your life?
There's more than one. I would say the most recent one was a patient who was declining. They were not going to make it, so we were withdrawing care. It was family member. We had multiple family members here with COVID. One of them feeling guilty, feeling like it was their fault, that they had passed it on to everybody. Having to wheel them over to say goodbye to their loved one. Hearing them talk about the guilt that they felt. Hearing them say they wish they had been vaccinated. Those are all hard.
A singular case in what's been a 2-year trail of tears. Here, that sadness plays out behind the closed doors on 3C.
Room after room of patients, all COVID positive, all in isolation.
There you go. Yeah.
There's joy, though, too. You find it in the faces of survivors across hospital systems. But Melissa says getting patients to the other side of the virus is tougher these days.
Are the demands now as much as they were last year at this time or at the height of Delta?
They're as high as they were with Delta, maybe even a little worse, because I feel like staff are more burnt out now. And we have lost staff to burnout.
Just like any employment entity, COVID impacts the staffing ranks. That on top of a nursing shortage in the region.